Learning the peritoneal classification of abdominal organs may feel like a task in rote memorization, but I'm here to make that task a little more active. The first question is, what do I mean by peritoneal classification? This is simply whether an organ is extraperitoneal, intraperitoneal, or secondarily retroperitoneal. Be sure to stick around to the end of the video to see how this information relates clinically. But wait a minute, what exactly is the peritoneum?
The peritoneum is a serous membrane that lines the abdominal cavity as well as the abdominal organs. If it lines the abdominal wall, it is referred to as the parietal peritoneum, as the word parietal means wall. If it lines an organ, it is referred to as visceral peritoneum. And the connecting part between the two, which consists of a double layer of peritoneum that holds the organ against the abdominal wall, is called a mesentery. All three portions of the membrane are continuous with each other, meaning that there is no beginning or end to the peritoneum. And the space within the peritoneal lining is the peritoneal cavity.
So back to the original question. How exactly do you know whether an organ is intraperitoneal, secondarily retroperitoneal, or extraperitoneal? To understand this, rather than memorize this, it's useful to think about the function of the organ. If the organ does not assist with digestion, the organ is likely to be extraperitoneal. This includes organs of the urinary system, including the kidneys, ureter, and bladder.
The kidneys and ureters can be further defined as being retroperitoneal because of their location behind the peritoneum, whereas the bladder can be defined as being subperitoneal due to its positioning below the peritoneum. Additional retroperitoneal structures include the aorta and inferior vena cava. Surgical access to extraperitoneal organs can be made via a route that remains completely outside of the peritoneal cavity. The structures are immobile and embedded in connective tissue. If the organ does assist with digestion, then it is either intraperitoneal or secondarily retroperitoneal. Thinking back to embryological development, organs derived from the gut tube were suspended from the abdominal wall into the peritoneum via a mesentery. In a diagrammatic cross-sectional view, it might look something like this. As the organs further developed, lots of twisting and turning took place, and in the process, some of the organs were pushed up against the posterior abdominal wall. The visceral peritoneum that lines the organ, along with their mesentery, then adhered to the parietal peritoneum that lined the posterior abdominal wall. Once placed along the posterior wall, the organ is located behind the original layer of the visceral peritoneum, so it's defined as being secondarily retroperitoneal. Secondarily retroperitoneal organs include most of the duodenum, the head and body of the pancreas, and the ascending and descending colon. These organs are described as being immobile since they are fixed to the posterior abdominal wall. However, they can easily be detached from the back wall again. This is frequently applied procedure during many abdominal operations. And lastly, we have intraperitoneal organs. These are organs that were derived from the gut tube and retain their mesentery throughout development. This includes all of the remaining abdominal organs, such as the liver, stomach, the most proximal and distal portions of the duodenum, all of the jejunum and ileum, the transverse and sigmoid colon, the tail of the pancreas, and the spleen.
Wow, that was a mouthful. Are you ready for the review? I'll call out the organ, and you tell me whether the organ is extraperitoneal, secondarily retroperitoneal, or intraperitoneal by doing one of 3 exercises. If the organ is intraperitoneal, forward lunge yourself into the peritoneum. If the organ is secondarily retroperitoneal, twist and turn your mesentery and tether yourself along the posterior abdominal wall with a side lunge. And if the organ is extraperitoneal, backward lunge outside of the peritoneum.
Stomach. The stomach is straight up intraperitoneal, as it was and continues to be suspended by not one, but 2 mesenteries. As the stomach began its development, its ventral surface was suspended to the liver via the ventral mesogastrium, which its dorsal surface was suspended to the posterior abdominal wall via the dorsal mesogastrium. Following rotation of the stomach, the mesenteries became known as the lesser omentum, connecting the lesser curvature of the stomach to the liver, and the greater omentum, connecting the greater curvature of the stomach to the posterior abdominal wall. The space that is formed posterior to the lesser omentum and stomach is known as the lesser sac. Pancreas. The majority of the pancreas is secondarily retroperitoneal, although a small portion is intra, but we'll get to that in a minute. The pancreas developed as an outpouching from the gut tube and therefore was held by a mesentery. As the stomach underwent its rotation, the pancreas was reoriented horizontally. The head and body of the pancreas were then pushed up against and fused to the posterior abdominal wall, thereby becoming secondarily retroperitoneal. The tail of the pancreas, however, remains suspended by a double layer of peritoneum, so it is intraperitoneal. This double layer of peritoneum is known as the splenorenal ligament and also houses the splenic artery and vein. Liver. The liver is intraperitoneal and also is suspended by 2 mesenteries. At the beginning of its development, the liver was connected to the anterior abdominal wall by the falciform ligament and to the ventral surface of the stomach via the ventral mesogastrium. Running within the falciform ligament was the umbilical vein that brought oxygen-rich blood from the placenta to the embryo and later the fetus. As we previously saw, the ventral mesogastrium then became the lesser omentum following rotation of the stomach. Following birth, the umbilical vein that's housed within the falciform ligament closes and becomes the round ligament of the liver. Spleen. The spleen is an intraperitoneal organ. Wait a minute, the spleen doesn't assist with digestion? True, but it was derived from the gut tube and developed within the dorsal mesogastrium. Following rotation of the foregut, the spleen moved to the left side of the body. Its mesentery was retained via the splenorenal ligament, which we talked about before, and the gastrosplenic ligament, which connects the spleen to the stomach and is part of the greater omentum. Duodenum. Secondarily retroperitoneal. The duodenum forms a C shape around the head of the pancreas. So as the pancreas rotated and became pushed up along the posterior abdominal wall, the duodenum did too. This is with exception to the first part of the duodenum that remains intraperitoneal. Ileum and jejunum. These are both intraperitoneal portions of the small intestines. The ileum and jejunum, as well as the large intestines, were suspended by a single mesentery that connected it to the posterior abdominal wall. Further growth and a counterclockwise rotation repositioned the cecum to the lower right quadrant of the abdomen. The jejunum and ileum remained attached to the posterior abdominal wall by their mesentery, which is now referred to as the mesentery. Ascending and descending colon. Both the ascending and descending colon are secondarily retroperitoneal. Following rotation of the midgut and hindgut, both were pushed against and fused with the posterior abdominal wall, thus making them secondarily retroperitoneal organs. Transverse colon and sigmoid colon. These two portions of the large intestines are intraperitoneal. Following rotation of the mid and hindgut, both retained its mesentery via the transverse mesocolon and the sigmoid mesocolon. The sigmoid mesocolon is not illustrated here. Rectum. The rectum is both intraperitoneal and extraperitoneal. Wait a minute. You said the organs that don't help with digestion are extraperitoneal. True, but the rectum marks the transition point for exiting the peritoneal cavity as well as the body, so its upper portion is intraperitoneal, while its lower portion is extraperitoneal, or even more specifically, subperitoneal, since it lies below the peritoneum. Bladder. The bladder doesn't help with digestion, never had a mesentery, and sits outside the peritoneal cavity, so is extraperitoneal. Suprarenal glands. The suprarenal or adrenal glands are also extraperitoneal. They sit on the superior aspect of the kidney and developed outside of the peritoneal cavity. More specifically, we could say they are retroperitoneal since they are located behind the peritoneum. That's it for the review. Now let's look at a vignette to see how this material relates clinically. Following a fall while snowboarding, a 20-year-old male is rushed to the emergency department. CT imaging reveals a large amount of retroperitoneal bleeding. What is the most likely source of this blood? The correct answer is the right kidney, since it is the only retroperitoneal structure listed.